What inspires me most is the human spirit and the ability for the human will to overcome adversity. You know, we're in a specialty in cancer care where people are subjected to a pretty challenging process, you know, maybe for the first time in their lives. And yet, for as difficult as it seems from the people on the outside looking in, these individuals seem to adapt relatively quickly, reprioritizing their lives and adapting to a difficult time. And that can't be lost on the care providers who see this every day. I was in training for surgery, and I had a surgical patient that had a gallbladder cancer. And for the first time in my training, I actually had to deliver that news to her and her family, and botched it. And it was a difficult time for me in my training process to kind of understand how I could have been so bad at that. And it caused a lot of introspection at the time. And within a couple of weeks, I found myself face to face with the same patient. And she forgave me for a terrible delivery of the bad news, but she also kind of welcomed me into her family in a very surprising way. And that was an eye-opening experience for me. And it personally kind of lifted me up, my spirit up, in a way that I felt that I had found what my true calling was within medicine, and found that I enjoyed that personal interaction more than I enjoyed a lot of the process stuff that you learn in medicine, which is what I was aiming towards as a surgeon. So I picked up and changed fields almost, you know, on a dime, and never looked back, and really do feel like she was the one person in my experience that exposed me to this epiphany. It's not difficult to find motivation in doing what we do every day. I mean, if you weren't aware of how fortunate you are, you're certainly going to be aware of it when you're working with cancer patients. So to get out of bed every day is easy, quite frankly. You know, you're constantly getting feedback from patients and families that you're doing something that helps them out. My philosophy of care is pretty simple, and that is to take care of people like you'd want to be taking care of yourself. And if you can see yourself in the eyes of your patients, you will do the right thing every time. The opportunity to come home and work for Inspira was alluring to me because I grew up in the area, and it was an opportunity to take what I've gained in knowledge over 15 to 17 years of practice and put it to work developing a new cancer center with people that I had high regard for as well. And so that mixture of opportunity was too difficult to pass up.